Did you know that black women are more at risk of developing fibroids than any other race, right? I wonder why. Why us? Anyway, we'll be talking to Dr. Kelvin Owusu about fibroids today. He'll explain what they are, how they develop, and why you should know your body very well and go for your checkups, your gynecological checkups, to see what's going on inside your uterus. So let's say good morning to Doc. Hi, Doc.
Good morning, Kokui. How are you?
I'm well. I'm well.
Good. It's been a while. Where have you been hiding?
I haven't been. You know what it is. It's
I
the
know,
whole 1 week, one week radio, 1 week TV. So I only see you every other week.
Too long.
You know, it's a long gap, I know, but it's all good. So
It
yeah,
is.
we're talking fibroids
Yes,
today.
we are.
Very
Yes, we
familiar
are.
with this topic, so I'm glad you're talking about it, because there are a lot of women who might not even know they have a fibroid until maybe they get pregnant or they go for some kind of checkup,
Yes.
get a scan, look at their womb, and then voila, there's this ball of something in there.
It's looking at you.
It's looking at you like, where did this come from? Okay, what is a fibroid?
Well, it's a tumor. I mean, that's exactly what it is. It's a tumor. Only that it's a benign tumor.
Okay.
You know, benign meaning that, you know, when people hear tumor, they immediately go straight to cancer.
Yes.
So it's not a cancer. You know, so tumor may either be cancerous or maybe benign. So this is a benign tumor, and it's found in the womb. You know, usually from the muscle layer of the womb. The womb has 3 layers. There's an outer layer, then there's a muscle layer in the middle, and then there's an inner layer. So the muscle layer is usually where the fibroid would start from, but it can end up anywhere. You know, so it either develops outward, you know, or it develops inward, you know, and so depending on where the specific location, whether it's closer to the inside or it's closer to the outside or it's actually hanging outside, then it derives its name.
Okay.
You know, and as a result, I mean, it also derives its features or symptoms that it causes. You know, so fibroids that are more closer to the inside of the womb have different symptoms that they can cause, and those fibroids that are outside the womb have different symptoms that they can you know, cause. You know, so depending on where they find themselves, then they exert their effect. You know, but generally, it's just a tumor that originates from the muscle layer of the womb, or the uterus, as you called it.
Okay, who's age-wise more at risk of developing fibroids? Is it younger women? Is it women who are older? Or is it any age group?
Any fertile woman can develop a fibroid.
Okay.
Now, emphasis on fertile, so any woman within the reproductive age group. So long as you are menstruating, it means you are fertile, you can achieve a pregnancy. And so if you are in that age group, then you have a chance of developing a fibroid.
Okay.
Particularly, as you mentioned, if you are black.
Yeah, man.
You know, it's been said, I mean, statistically, about 70 to 80% of black women will have fibroid at some point. And interestingly, most fibroids would only be seen incidentally. So maybe you are going through a scan for something else unrelated to fibroid, and then they'll discover that you have a fibroid. And actually, we like it like that, because it then means that the fibroid is actually not causing any problem. You know, so in other words, most fibroid will actually not cause any problem. I mean, they will peacefully coexist,
Yeah.
you know, with whatever is going on in the womb for your lifetime. And then when you stop menstruating, when you reach menopause or just beyond menopause, they begin to involute.
Okay.
You know, because one of the things that keeps the fibroid going is your fertility hormones. You know, so your estrogen, your progesterone, and the interplay between the two. In fact, some of the theories suggest that because the uterus seems to expand, contract, expand, you know, as your cycle continues, you know, the uterus goes through some changes. So the muscle layer or the inner layer, everything is going to expand to prepare you to receive a pregnancy. Then the pregnancy doesn't happen, so it involutes, and so that expansion, contraction, those changes that the uterus goes through is what sometimes may trigger the development of fibroid.
Okay.
As to why it's more common in black women, that's a whole different discussion, you know, but there are things that are common to various races. You know, it's just unfortunate because we find ourselves in this category. A lot of what we discuss is related to us. So for instance, hypertension is commoner in our race. Sickle cell is common in our race.
Yep.
You know, a lot of things. Some have even said that poverty is, you know, but that's another discussion
You
altogether.
know, but you would think, I mean, because something affects us so greatly, shouldn't we be doing more research into it to find out the root causes? You know, we as in black people,
Yes.
because most of the research is done by other
Elsewhere.
cultures and jurisdictions. But if we know that this is something that affects us so badly, maybe we should look more deeply into it and fund some research to see what could be the cause. And then perhaps if you identify that, then you can start coming up with some preventive measures. Because,
You know,
like you said, they can peacefully coexist,
Yes,
but
yes.
sometimes they can be troublesome too.
And when they are troublesome, they do cause a lot of trouble.
Yeah.
Yes, a lot of trouble. I mean, it's been said that because we, especially those of us in sub-Saharan Africa, we are still dealing with the basic needs, you know, food, shelter, clothing.
So we don't have time for
we don't
research.
have time for research, you know. But
Okay.
if we actually did invest just a little bit into research, we would realize that some of the solutions are so made, may actually be so simple, you know, but unfortunately it's not available to us. And so,
Okay. Well, you hit the streets.
Yes, I did.
You're getting good at this vox pop thing, oh, Doc. I think this is your thing, you know. Anyway, Dr. Kelvin went out to find out from people what they know about fibroids. So let's take a look at this.
So we just want to find out, what do you know about fibroid?
Okay, so I know that fibroid is a non-cancerous growth in the uterus of mostly childbearing ladies. So during their childbearing years, that is when they experience or fibroid is likely to develop in their uterus, yes.
But do you know what causes it?
Okay, I don't know exactly what causes fibroid, but then I know that it could be an abnormal growth of a muscle or something related to that, but I don't know exactly what causes fibroid.
And do you know what the treatment of fibroid?
Personally, I have heard that a surgical procedure can do that, but then again, mostly in public transport, you have some of these local medicine sellers claiming that they have drugs or medicines that can melt those tumors, but I don't know how far that is true. But as far as I know that a surgical procedure can deal with it. Yes.
What was your experience with fibroid?
Okay, from the onset or from beginning, I didn't know anything about fibroid. Not until I went to a gynecologist for another issue, and it popped up. So I didn't know its complications. Not until it grew. So when I lie down, I see my tummy enlarging. So my sister, after her nursing training, came to stay with me, and she realized what I was going through. So she registered me at Kolebu, and then I started from there. And I had surgery.
And following the surgery, anything else happened?
Later on, I had it again. So I went back. They said, still another one. So I left it that way.
So do you have any advice for other women in similar situation?
Yeah, I wish it should be discussed so that all women will know about really what fibroid is, because it has given me a whole lot of problems. I lost pregnancies about 3 or 4 during that period, so it should be discussed on any other platforms so that a lot of the women will get to know this is the cause or whatever it is that brings the fibroid. We don't know whether our food we take, we don't know. So it should be discussed openly for everybody to know about fibroid.
When you my friend a fibroid?
Oh, minimum say or more say bibi what say fibroid. Nanso me who be da say the eti, me who say the eti, but me who say or for say fibroid say ni say nanso minimum say the eti.
Why are they putting on kafa ho?
Fibroid no mo ka say e bia say unya we a ti say umoja no nani entumi ye adwuma etumi ma fibroid bebre nyama bebre etumi ma saa wow nanso me hu obi da no so ebi nim hu ebi nim busiafo entumi hu se de eti ana
na ba sure omo kan ho asem na omo say ni treatment ye den ana unyante
e de be nyanti ye the minimum say hawa ana sɛ wɔ na hu sɛ how pa ne de sɛ wo call hospital na doctor hwɛ wo kakra hwɛ sɛ wo omutumi ebi mu wɔ ha be operation asa na be free e wo e be ma we dro na moja no anane na ho atɔ e be twisi wo kakra asa na ho be tɔ.
What do you know about fibroid?
I know it's a blood clot. When the woman, the menstrual flow, when it didn't come well, yeah, then you have the clots inside, then it turns to fibroid. Yeah.
But so do you know anybody who has got fibroid?
Yeah, I have a sister who has a fibroid.
And she still has it, or has it been treated?
No, it's still there.
So why hasn't it been treated? Or do you know the treatment for fibroid?
No, I don't know. I want her to go for a surgery, but she's scared. So yeah, she's still there.
What do you know about fibroid?
Okay, I know it's a disease that actually affects women. Yeah, it's within the let's say within the stomach. It happens within the stomach. The little I know is a clot of blood. When the blood doesn't flow and become clots within the system, they create that thing. That's the little that I know.
But how serious is fibroid?
Well, I have experienced it. My mom passed away through fibroid. Okay. Yes, and I think it's not a friendly sickness. That's what I would say. So that whatever generate that thing into the system of the women, we should try to curtail it, or we should help them so that they can be able to curtail it.
Hey, so that was some street knowledge about fibroids. I was really impressed with the first gentleman you spoke to, though.
Yeah.
And he seemed to, it's like he was in medical class with you. Like, yeah, he had definitions, treatment, he knew like everything. But there were a couple of people who spoke of fibroids as being a blood clot.
Yes, and I mean, we didn't show all the clips, but that was actually the predominant view. A lot of people will actually think fibroid is a blood clot, and that if you have your period, so somebody actually, if you have you're supposed to have a period for 7 days. So if you have it any less than 7 days, you're going to actually have the rest of the days, congeal and then
form a fibroid. Oh my goodness!
And I have actually, interestingly, I've actually had experienced this myself. Back in the day when we used to be in Trotro, the Trotro salespeople will come up and they will give you all this pathophysiology of fibroid, and woe unto you. I mean, I had my fair share if you try to correct them. I mean,
you're kidding. Even with your medical knowledge, you're trying to educate
who cares
them
about your medical knowledge? You are in the Trotro with me. The expert is the one talking, so keep quiet and sit in your corner. That's actually that's the response I got when I tried to correct the gentleman, because I mean, I was fresh out of medical school. I was hot with information, So when the guy was going on about that, I was like, "No, Masa, you are telling lies. This is not true." And the whole Trotro was against me because, well,
and they believed him.
Yes, they believe, and people actually bought. In fact, it looked like I helped him make more
sales.
No. But the reality is that there's fibroid is not a blood clot. Period. And you see, we are in the social media age. You can actually see there are videos about people live surgeries where you can actually see the fibroid being brought out.
Yes.
And it's not even red.
Exactly.
It's not even red
it's
for
tissue.
it to. Yes, it's not even red. So you cannot. It's not blood. It's not related to blood in any way. And it's not related to your how long you are supposed to bleed. Of course, I mentioned that there are different kinds of fibroids based on their location. If the fibroid is closer to the inner layer, what happens is that it's going to increase the surface area of the the inner lining of the womb, so that then if your surface area has increased, it means that you're going to bleed more. So people with fibroid, especially those ones that are in the inside of the womb, they tend to bleed a lot more. So maybe your normal cycle was 5 days, 6 days, but now you're bleeding for 2 weeks. I've had a patient who was bleeding continuously for like a month plus.
Oh.
Yes, and so that's how bad it can get. So if you have such a situation where you are bleeding significantly, your period is all over the place. It starts and doesn't end, and then the next one also begins. It could be that you have a fibroid that is actually sitting very close to the lining of the womb, and that's what's causing this problem. And interestingly, this is, even though generally speaking, fibroid, the woman mentioned that she had lost a couple of pregnancies.
Yes.
Generally speaking, fibroids do not affect pregnancy. Now, I'm stressing, generally speaking.
Yes.
However, depending on the location, it can make implantation a bit difficult. You see, because the fetus, the fertilized egg, there's a specific place it must implant. But if the air gets to that place and there's a fibroid hanging over there, it will be difficult to implant, and so you might have issues of difficulty achieving pregnancy, And so whenever a woman is having challenges with pregnancy and they go to hospital and they discover that she has fibroid, they will recommend that let's remove the fibroid to increase the chance of you getting pregnant, And so that's why you go through that process, because if the fibroid is there, like I said, it may, emphasis on may, prevent the fertilized egg from actually getting implanted. Very, very important. You see, but generally speaking, the fact that you have a fibroid does not mean you can't get pregnant, because there are people, several people who have had fibroids and have had successful delivery. In fact, some of them even had, some of them even had a successful vaginal delivery without having the need for any assistance. So fibroid does not equate to difficult pregnancy. Very, very important.
There's so much misinformation out there, which is why this is important, what we're doing here to educate people, especially when it comes to treatment. Now, some did mention, okay, you need to have surgery. And of course, some mentioned your favorite people in the torture who are selling concoctions. Is there any concoction out there, Doc, that can melt your fibroid or dissolve it, make it disappear? What's the truth?
So interestingly, was it just yesterday? I was scrolling through TikTok and there's a trend where some woman is passionate about having used herbs to dissolve her fibroid, and the questions and people who are interested in the recipe, and it was amazing. And I was wide mouthed. You cannot dissolve a fibroid, period. There's no medication that can dissolve a fibroid. In fact, there's no treatment modality that requires you to dissolve a fibroid. The only way to get rid of fibroid is through surgery. There are medications that can temporarily reduce the size of fibroids so that it will make the surgery manageable.
Okay.
But remember that I mentioned that the reason why you're having a fibroid in the first place is because you are fertile. So once your fertile hormones are active, the fibroid will continue to grow. So if you want to reduce the size of the fibroid, we literally have to make you
stifle your fertility.
Exactly. So we literally have to create menopause conditions. And so we cut off the hormones, and then that would then begin to shrink the fibroid. But how long can you make somebody menopausal when the person is not yet menopausal? So even that medication, the longest I've heard would be to go for about 6 months.
Okay.
And the rationale or the idea is that the fibroid is too big. Let's reduce it so that it makes the surgery smaller, less complicated. So that's the only time where we use medication. Otherwise, it is surgery. Now, the other woman also mentioned that she had surgery previously and then a fibroid returned. This is another serious matter. You speak to women and they will swear that their mother had surgery and the fibroid came back, and so surgery does not work. Now, here's what we need to understand. The fibroids, there are multiple. So thankfully I have actually been involved in fibroid surgery, and so I know what I'm talking about. There are multiple fibroids. Some are small as my fingernail, others as huge as my head. So when you are doing an operation and you go inside, nobody is going to be chasing the small fibroid. Nobody has time for that, because the complication of chasing those small fibroids, remember that you have a limited time to do the operation. You don't want to keep somebody's belly open too long. So you want to go in there and tackle the fibroids that are causing the problems now.
Okay.
So you go in there and remove all the obvious fibroids, but there's no way you can remove all the fibroids. And so after the surgery, if that person recovers, everything is fine. But so long as that person remains fertile, another fibroid will develop.
Okay.
And so the trick or the teaching is that we wait until we are not in a hurry to go and do fibroid surgery, except it's causing complications. So that if you are in your 20s or in your early 30s, you should not be in a hurry to go and remove your fibroid if it is in a peaceful coexistence with you.
Right.
But if it's causing problems, then definitely we will remove it. But just keep in mind that another one may develop before you reach menopause, and it might require a surgery again. This is very, very important, because a lot of women have kept their destructive fibroids because of the fear that if they remove it, it will come back. So if the fibroid is causing problems, let's deal with it. Let's deal with today's problems now. In the future, we can figure out a way to sort it out. Okay. And you see, the other thing I must add is that if we actually dealt with if a fibroid is causing problems and we deal with it early before it becomes too big, it can even be removed through a pinhole.
Yeah, I've heard that. And
so the reason why they require open surgery and all those complicated procedures is because we wait for our fibroids to be too big. I had a chance to go and do an exchange program elsewhere, and they got somebody who had a fibroid. We describe fibroid according to weeks of pregnancy.
Okay.
Somebody had a 32-week size fibroid, and it was a big deal. They actually called all the residents to come and have a look at it. I mean, and I'm sitting down like I see this every day. This is normal. This is normal. Wow. But they actually called all the residents to come and have a look at it. This is amazing. This is our first time we are seeing such a huge. I mean, it was a big deal. It was crazy.
Wow.
You know, so they actually had the PS system go off, all residents report.
Really, to come and look at this fibroid.
It was a big deal.
Something that you've probably seen bigger ones and more often here.
Exactly. You know.
Wow.
And so fibroids are real. They can cause. I mean, one of the complications they cause is actually kidney issues, because when it becomes so big, it can lie on the ureter, which means that it dams the urine. The urine is not able to flow properly. You know, so it can cause kidney issues. It can cause so many things.
Why do we have to go through so many things, Doc? Okay, so we should go for our gynecological appointments.
Yes.
Get your regular annual exam or scan or whatever it is, and just keep in touch with your doctor. You know,
we are your friends.
Your friends.
Yes, and you see, the primary role of a doctor is not to treat illnesses. Our primary role is actually to prevent it. So stop turning our role as, don't define my role for me. You know, my role is to prevent the illness, you see. So help us help you.
No, in Ghana, we like to be reactive, not proactive, you see. So it keeps you in business. No, but thank you, Doc, for the education. Really great. How do people reach you? Well,
I'm active on social media, Kelvin Owusu MD, so you can just follow me over there in any channel. And also my clinic page, Claron Health International, also active on all social media channels as well.
Great. Thank you. Always a pleasure. Okay, guys. A word to the wise is enough. Go and see your doctor. If you've been watching us, you need to go. You haven't seen your gynecologist in 5 years. Please go. Go and see the doctor. All right.